Okay,
Hi
it's live.
everyone, welcome to another Fresh Dental Shadowing session. Today with us we have Dr. Peggy Bown and Dr. Penny Dhaliwal. They're cosmetic dentists and they'll share their journey with us. And then after we will have a Q&A on our Instagram live at Fresh Dental Shadowing. So Dr. Peggy, you may begin when you're ready.
Right. Thank you for having us. This is really exciting. Yeah. So I hope everyone's having a great summer, and we want to share with you tonight what we're doing in our practice, and kind of go through, hopefully give you some great tips for.
Hopefully answer your questions of how to get into it.
Yes.
Which is why we're here.
And at the end, we're going to go live on Instagram. So, all right. So who are we? My name, of course, is Dr. Peggy Bown. I'm the owner of Lux Dental Aesthetics, and this is my partner, Dr. Penny Dhaliwal, and she is my associate right now. So, yeah, so it was great. We thought it would be helpful to come on as a team because I graduated about 21 years ago. So I started dental school 25 years ago, and Penny just...
I am a recent grad, so I just finished school in 2021. So we have an experienced dentist talking about 25 years of dental experience and a new grad. So you get that best of both worlds, I guess. It's going to be amazing.
Yeah, so that's what we thought would be helpful. So what are we going to discuss tonight, Penny?
We're going to talk about a little bit about us, talk about what we do, our clinic, my journey in becoming a dentist, which is pretty recent, and then Peggy's journey, which is 25 years ago, the relationship we have as a principal dentist who owns the clinic and an associate who just graduated recently, which includes how to look for jobs, how to really see dentistry after school, and finally, and most importantly, things you need to know to get into dental school, which is why you're here, and a little bit about what happens after dental school.
Yeah.
So we might want to prepare you. I wish I had that 4 years ago. I would have known more. But yeah, a little bit about if you need specialty programs or not, if you really want to specialize, if GPR and AEGD programs are going to help you or not. Current life at Lux Dental, because we are a cosmetic aesthetic dental clinic, and which is very different of what you will learn at school. So it's going to be pretty exciting. Yeah. We're also going to talk about challenges with becoming a successful dentist, life outside of dental school, basically. A little bit about cases. Dr. Bown is going to discuss big cases that she does at the clinic. And finally, you can reach us at social media. I'm going to show you how to reach us using Instagram, using LinkedIn. If you have any questions, you can just ask.
Yeah, and we're going to just sort of show you a little video at the end to share with you, like kind of what it's like
you
for
made
our
something
patients.
really cool.
Yeah. All right, so let's get started. All right, so first of all, many of you, I'm sure, are all over, probably at least North America, maybe further. And we are in Canada, and we're in the province of New Brunswick, and it's St. John is specifically the little city that we're from. It's about, for reference, it's about an hour and a half drive north of the border of Maine, USA. So our population, again, is not a big city. It's an old port city. It's known for its highest tides in the world. So if you ever want to take in some amazing tidal experiences, you should come here for sure. And it's really, a lot of cruise ships come into the port, and it's a lot of Irving oil and things like that. That's where all that kind of started. So we are again, like Penny said, we're really a digital cosmetic practice. However, we do everything. We do a lot of general dentistry too. It's just that we geared the practice almost more towards that kind of specialty. And it's been really exciting. And of course, Penny's learning lots, and she gets to work with me on big cases. So
it's amazing.
Yeah. And so our practice though is very digital. So it's completely digital, actually. We don't even use goopy impressions in any way.
Which you're going to have to learn in school. So
yeah, exactly. You do learn all that stuff, but then when you get out, you can choose to kind of really adopt a lot of digital. We find a lot of the dental schools right now are not really fully adopting the digital, but it's all waiting, ready for you as soon as you graduate. And so we're actually also, as far as the clinic goes, specialized in what we call digital smile design. So I am a digital smile design master, and we're one of 4 DSD clinics in Canada. So We're the only one in Atlantic Canada, which is 4 of the provinces on the East Coast, and we're only 1 of 4 in all of Canada. So it's a little bit of a specialty practice, and we want to really share that with you a little bit, but we want to also kind of help you get from where you are right now, which I believe is not in dental school yet, to kind of knowing what to expect. And just with that broad range of time between the two of us, we're hoping to kind of help inspire you and give you some great tips. Okay? Do you want to add anything to that?
I just thought about something when we were talking, that when I started dental school, I didn't really know what I wanted to do in dentistry, because dentistry can be really broad. There's so many things that you can do. And if Dr. Bown has really found her niche that she loves doing cosmetic dentistry. So if somebody out there who really is interested in cosmetic dentistry, this presentation is really going to help you a lot. Because if you gain more experience by just looking at what's out there, you're going to be able to make better decisions while being in dental school, whether you want to specialize or not.
Exactly. And maybe even someday come chat us for real.
Yeah, just text us.
Okay, great stuff. So I just put a couple of images, well, just this image in particular, of my main operatory suite. And like I said, we are DSD clinic, so we're co-branded with DSD. And we really try to gear our marketing towards 2 types of groups of people. I mean, younger people, of course, and then that sort of group that really wants to see a change in their smile. They've lived with their problems for many years, and now they're really ready. So we, again, really try to market specifically to that. And then when you come in, the way the practice is set up, if you look at this operatory, I mean, maybe you've seen your own dentist, even in your own clinics where your dentists are, and seen their operatory, it does look like a dental operatory, I of course. But what I wanted when I designed this clinic was I really wanted the patients to feel like they're somewhere different. I didn't want them to feel like they're in a typical dental clinic. And so there's it's very minimal. There's no a lot of things all over the countertops. And it's, again, the dental chair has to be there, but it's really open and bright and spacious. And as a little girl, I really had a great experience from a dentist that really did something really different. So it's my mission to always surprise and inspire my patients to experience something really fresh, really new, and think of dentistry in a really fun and not scary way.
Right? Fear. Because really, you want the patients when they walk in to feel comfortable. This room provides comfort. They feel like they're in a space where they're not supposed to be scared of the dentist, which is a big thing in dentistry. A lot of patients, you'll notice that once you get into dental school, that people don't like us. And dentists are
they're afraid.
Yeah, they're afraid of us. So we really wanted to change that perspective, and I think Dr. Bown's clinic is amazing that way, because when you walk in, you have this feel, probably entered a spa than a dentist.
Yeah, so we really changed the vibe, and it's actually been deemed as a sensory-friendly clinic. So there's a lot of things and features from smell to sight to just what the patient experiences. Types of comforting things that we give our patients that really enhance the sensory experience and also help minimize the anxiety that people feel. Okay, so a little bit about my background. We're going to each go into each of our backgrounds. I am an undergraduate of Mount Allison University. It's a undergrad university in New Brunswick. And I did a major in biology with an honors thesis in ecology. Yes, I studied guppies from Trinidad for that. Not really very applicable to dentistry, but it was kind of interesting, and it really, again, it was a great experience because it's a really small university. Then dental school, I went to Dhaliwal Dentistry. Dhaliwal Dentistry was there from 1997 to, which again started 25 years ago, this fall, and graduated in 2001. And the main deciding factor for Dow was that it's in the Atlantic area. It's the only school in Atlantic Canada that's in a dental school. So for 3 provinces, which are considered for anyone in the U.S., sort of states, of course, there's only 1 dental school for 4 provinces. So that is the ultimate place to get. And it's an amazing dental school, and it was just a little higher likelihood of me getting accepted. So that I applied there, and I was so fortunate and so excited. I wanted to be a dentist since I was 14 years old. And so to get in on the first try was very oh my gosh, I think someone was looking out for me, because I know it's very challenging and can be scary to not get in. So I did have a backup plan. I was going to be a marine biologist or do something else if it didn't work out, but I think it was meant to be that I'd be a dentist. So So I was an associate dentist for about 3 years, from 2001 to 2004, and then I joined that practice. I purchased part of that practice, and I was in that group practice for 10 years. Then in 2014, there became a very big break in between me and the partners of that clinic, because I was starting to do a lot of advanced dentistry. I'd done a lot of advanced training in the United States, and I was really starting to be different. I wanted to market the clinic. And they didn't. There was a little bit of a separation there. So in 2014, late 2014, I started my own solo clinic, and it was called Peggy Bown Dentistry. And you can still look that up, Peggy Bown Dentistry, on actually it's fun more easily on Google than you will Lux Dental Aesthetics, because of course we just rebranded and just changed the name. So it's been 7+ years there, and in that time I've done a lot of lecturing, both nationally, internationally, and I am a faculty member for Align Tech, which is the company for Invisalign and iTero, and I've been faculty since 2018 for that. And I've done a lot of advanced education. So one of the things you think of, you're like, okay, when I'm done dental school, I'm going to be, probably done, but I can't even imagine how many hundreds of hours I think I've done. And I've also done several residencies in different types of dentistry, cosmetic dentistry and reconstructive dentistry, such as the Las Vegas Institute of Advanced Dental Studies and Digital Smile Design. So, really traveling the world, taking in the courses that I really enjoy doing, and that's going to be for you when you get there. But that's pretty much my journey. And again, everything was driven for me from that childhood dream to want to inspire my patients and do something really special for them. Okay, Penny, you're up.
Okay, so unlike Peggy, I did not dream of becoming a dentist. So I'm a bit of a different seed, I would say. So I was born in India. So I did my undergrad in India, and I was an engineer back then. So I had a degree in biotechnology, but I got accepted to this grad school in New York. So I did my master's in biomedical science. It was a really cool experience. I was doing research in immunology and infectious diseases. So if anybody out there has watched Breaking Bad, they know what Bryson Thompson is. So I was working with a very deadly toxin, and I was working with the Department of Defense in the States, and I had a lot of fun doing that. But there was something lacking personally. I just felt that I didn't have a connection with people, and I wanted to do something in science, which is more related to communication and helping people out personally rather than being behind the desk and working inside a lab. So I had a friend, and I was talking to her one day, and she was like, why don't you join dental school? Like, it's a part of science, and you already have a master's, you might get in easier. So I just gave it a shot, and I wanted to go to University of Toronto because it has a big research department because of my history and my past. I love doing research. So I was like, I'm going to give it a shot. And I think my luck aligned as well, and I got in. A number of deciding factors can come in when you're applying to dental school, which are the things that we're going to discuss today. But when I talk about University of Toronto, I think it's the biggest university, I think, in Canada that's doing a lot of research. So they do take a lot of incoming students. Like, their group of students is larger than most Canadian schools, and they also take in people who have graduate degrees. They have like a different pool of selection. Like, for example, they take 120 applicants a year. Out of those 120, they keep 25 international applicants. They give 10 applicants the chance of having a grad degree. So you're not really competing with the undergrad. So that made me feel very confident. And along with that, a lot of other skills that we're going to talk about that can be deciding factors for getting into school. But again, I graduated in 2021, and it was a really good 4 years for me. I learned a lot. And then I found Peggy. So I've been working with Peggy since 2021. It's almost been a year.
Yep, we're coming up on 1 year.
Yeah. And then I've learned so much from her. And I would say I've learned a lot of dentistry after graduating. Probably more than 4 years in 1 year. So you're going to see that too. Like, I know that you need the basic foundation which the school is going to provide you. But when you leave school, the real dentistry begins, and the real learning, the communication side.
Too.
Yeah, and there's so much to dentistry than just being just artistic and learning the skills. I think it also involves talking to people, leadership skills, and all of these things are going to come while you just follow the journey. So that's been my journey so far. I'm really excited to go on and do more courses. So.
Yeah, exactly. Okay, so We did already talk about this a little bit. How Penny found me was just on your search, but we want to dive into, again, just kind of more detail into how. I personally, and again, I don't know if any of you are already branding yourself on social media. You're not a dentist yet, so maybe you don't feel, or you at least have Instagram, you have LinkedIn. But I put an ad on LinkedIn, and I also posted, and I have, a lot of other ways people can find me. So luckily, Penny found me on on LinkedIn. And I was one of the few dentists, though, and we'll note this, that had like all the social media sites, had a great website, and then when we met, we really, we hit it off, but we did several interviews. So I didn't just, of course, COVID played a role in that.
Which helped a lot.
Yeah, but we really made sure we were right for each other, and that she answered a lot of her questions, gave her time to think about it. And then she, in the meantime, was, you were interviewing other doctors.
Yeah, and I was doing my
own
research, and it's not like I only applied to one place. Just like when you apply for dental schools, you're probably going to look at a lot of things like location, the type of school you want to get in. So I was doing the same thing after graduating. Like I applied while I was still in school, so I wanted to keep my options open. But the criteria was to find a clinic that has digital technology, and it's not really old dentistry. It's the newest dentistry that I can learn from a mentor. So the big thing was mentorship for me. That was the biggest thing, because I know being in dental school, and especially a COVID grad, we did lose a little bit of time with clinic, and
That's right,
we did, and unfortunately we were called COVID grads. But what I was looking for, somebody who can take my hand and help me through the journey and help me gain more confidence, because when you're going to go to school, you're going to realize that you're going to be doing procedures in 3 hours, and then when you go to private practice, it turns into 30 minutes. So that's a journey that you need somebody that you trust.
How can we do it faster?
Yeah,
but still with quality, right?
Exactly. And then it's very different when you leave school, and you want somebody that you can trust. You want somebody that would not judge you. You want somebody that will boost your confidence, not really push you in a negative way. So that's what was really the biggest factor for me when I met Peggy. And then we hit it off in our meetings. So that would be my advice to you once you've graduated. If you go look up a clinic online and you talk to the person that you want to be working with, as long as you have the same type of values, I think it should be a great relationship.
Yeah, and you did know that you were considering coming to New Brunswick too.
Yes,
you were in the city before. Location's a big one.
You fix your location first, and then you look for the clinic in that location.
Yeah. And if you don't know what location, then that's great. Just kind of look around and talk to different vendors. And then we really, in the clinic, we often, like, our team will sometimes refer to us as Dr. Bown and Dr. Dhaliwal, but we try to, we want our patients to feel really comfortable. So that goes in keeping, again, with the experience of the patient. So they'll call us Dr. Peggy or Dr. Penny, which does get confusing, I'm not gonna lie, some days. But they'll call us Peggy or Penny.
Yeah,
we don't get
really
too caught up in titles.
Doctors sometimes, because we want our patients to be really our friends, and that's how you build the trust with somebody.
Yeah.
You can't just ask the patient to trust you and they just met you. You build a relationship first. So I feel like just being casual.
It breaks down the feeling of
the fear too. It's we're just like you. We're normal people. You don't have to be scared of us. So we want to make sure that our patients feel very comfortable before deciding if they want to go ahead with treatment.
Exactly. So, and then the last thing is how we work together to provide the best patient care. So when a new patient comes in, they are screened, and if they're already just looking for something very specific and advanced, then they will see me first probably. However, a lot of new patients are coming to the clinic, and we don't really know, so it doesn't matter who sees them. But once we meet them, we realize, okay, this person needs, maybe I need to do the Invisalign, maybe Penny needs to do the crown, so we will get to meet them both. So we try to make sure that a lot of the new patients coming to the clinic get to be introduced to both of us in a very short period, if not on the first visit. And then they know that we're a team, and if they have to see one and not the other, then they'll still feel like they're being cared for, and that there's a continuity of care, and that we're on the same page. So not a lot of offices work that way. A lot of dental offices, the senior partner will just sort of kind of be in their own, have their own patients, and the associate will have their own. But what we're finding as we kind of go along is that it really works for patients to feel like, they're getting, the collaboration. And I think the big thing with us is just like, my philosophy is to collaborate and make a patient feel that like everybody's pulling for them. We're all on the same page. We're on the same team. So so that's kind of how it works. And so, Penny does a lot of course, restorative. I'm now teaching her how to do Invisalign, of course, too. But we've got like a good kind of system going where the patients can kind of see either of us, and we can both do root canals and things like that. But again, a lot of the more sort of general dentistry right now is being done by Penny. Okay, tips for getting into dental
This
school.
is the slide you've all been waiting for. We're done introducing ourselves.
Sorry, it took long.
So, if I want to just start a little bit, and I'll let Peggy finish and add her own just tips of getting into dental school. I know this is a no-brainer. Everybody knows that you need a good GPA, and it hasn't changed over the years. I think when you were
it's always been the same. But my GPA wasn't the highest, so I still got in.
I mean, having a good, and we're not really looking for really high GPAs, but having a decent GPA is really going to have that. You need to have. You need to have the basics. Yeah, you have to have the basic foundation. So another thing that you really need to be thinking about, because I don't know if you guys are third year undergrad, fourth year, really need to have a timeline, because you need to take the DAT exam, and then you need to be applying to schools, and every school has a different deadline, and you have to wait for the interviews back. So give yourself maybe a year. I would do this if you were in third year right now. I would just start working on it, like maybe give the exam this year and then apply, because it really is a 1-year process. And some students really take some time off. If you do have the privilege to take time off after undergrad, like for a vacation, enjoy a little bit, and then maybe take some time off and then give the exam. That's really up to you. But usually people do have a timeline to do that. Mm-hmm. And another thing would be looking at different types of dental schools. If you're in the States, you do have a lot of options, because you have so many schools in the States. Every state,
probably.
Yeah, we call it province in Canada.
Yeah, but we don't have a dental school in every province.
Yeah, we don't. So it's very limited. In Canada, a lot of competition, because we only have a few dental schools and everybody wants to get in. So there's a lot of competition that way. But if you're in the States, I think there's less competition because of the number of schools that you have. Mm-hmm. So, but also it depends. Like if you really want to get into the top notch, then you have to look at the different prerequisites of that specific school. If you do need any courses, this is the time to take that course in your last year's undergrad. And at the end, it all depends on what you want, and do your research. Other things that you can start doing now is volunteering.
Yeah, we both did a lot of volunteering.
We both did, actually. And I did a different type of volunteering. Like I went to a private clinic. I actually went to a clinic that was owned by a U of T grad. So he graduated 25 years ago. Okay. And he actually graduated the year I was born. So he knew a lot of things about U of T. And then he showed me the private dentistry part of how do you run a clinic, and how do you see patients, and what kind of dentistry you're going to be doing after you graduate if you want to open up a clinic.
Yeah, I mean, it's part of what this is all as well, like learning from other dentists and asking questions. With social media now, you can really kind of pick our brain. You can reach out to us, but I, at that time, like I really went to see him, and I was working with him. I wasn't working, I was just shadowing him, so I would see him every day, literally just walk around him with a cup of tea, like just his nice.
Kind of following his shadow every day. So
that helped. Do you think that helped get you into dental school, showing your commitment to?
Yes, and also helped me understand what I wanted to do after dental school, because everybody is different. Somebody wants to specialize, somebody wants to go into private dentistry, somebody wants to get into the hospital. So that might be a good idea right now. And I know you did a lot of volunteering.
Yeah, I did a lot of volunteering with special needs kids and with geriatrics at the hospital. And then we also kind of put in here, like, really just volunteering with different social causes that you believe in, and helping with fundraising and being part of your community. They look at that very favorably.
Yeah. And then finally, like once you're ready with all of, you pass the exam, you're ready to apply to schools, I think you really need to work on your resume. And I know a lot of people believe having a very long resume is going to get you in, but I think it's all about the quality than quantity. So if you can add specific things like volunteering, showing your personality, adding some extra things like what do you like, sports and hobbies, the ability to show your personality so that your resume stands out from all the other applicants that are out there. Because there are going to be a lot of people applying, and you don't want your resume to be boring.
So they did ask for a resume from when you applied?
Yes, because I had grad school, I had the research experience, I had to show off what I did in my undergrad. So I really did a lot of research projects even when I was in undergrad. So I added all of that to show off what I have already, and that was a good way, I think.
Yeah,
it was good. Again, I'm going to talk about the higher education. There might be some of you out there who, like me, they did their undergrad, you guys are probably doing your master's right now, and you're thinking, okay, maybe I want to get into dental school, maybe this is not what I want to do, and you can switch. I did it, so you can do it too. So same thing, I'm going to say, just do your research and make sure. For me, I think there were some courses that were missing in my undergrad and master's together. So I took some courses online, and U of T had that. So I just used the same school. I send them an email. I talked to the registrar and it's like, okay, I want to apply to U of T dental school. These are courses I'm missing. Can you tell me how to get those courses? And she gave me the U of T continuing education website. So I made sure I had all the courses applied. So even if you don't have courses, there are ways out of it, and you can get into dental school. So that's a big takeaway.
Don't lose hope.
Don't lose hope. If you're changing careers, you can still do it. Even if you're in your 40s or 50s, you can still do it.
Exactly. So the letters of reference that we mean here is the always like put some references in there, but when we say make it versatile, what I find again as an employer too is a lot of times people will just put in their professors or whatever.
Which is basically the people you know in school.
Yeah, but it's nice to have someone maybe who's known you for many years or has some sort of other relationship with you outside of the educational pool. Yeah.
And then again, a big one is statement of purpose. So this is where you're going to show off your personality, and you just need to convince the schools that why should they give you the seat and why should they pick you. Why are you passionate about dentistry? Why do you think you want to be a dentist? What made you, like Peggy said, she was 14 when she decided to be a dentist. So that's something that really shows off her passion. It's like, okay, I want to be a part of this amazing field. So that should be something you should be writing in your statement of purpose, and making sure you give them a personal side of you so they know who you are. It just does not have to be all black and white. You want to make sure you have something that's outstanding, so they
something really cool. Like it could be a story too, right? So storytelling is a great way to both market. Well, it's a great way to market anything, but market yourself.
Basically, market yourself.
Exactly. Yeah, and that's what you have to do. So be bold. So the GPR, we don't want to spend too long on this because you may not be kind of at this point or interested, or maybe you don't even have many questions in your mind about this, but we wanted to add this here, partly because, again, some people do wonder about it, but of course, it depends. I don't know if it's different in different countries, but a lot of new grads are thinking, well, not only am I going to have to do dental school, I'm going to have to also do this 1 year general practice residency after, and so it's really 5 years. It's really more. And the thing about that is that I personally think, it's really a good idea to consider, not get too caught up in that at this point. We feel that a lot of people who are really considering the specialties, like right from the get-go, of course, you probably count that in as something you have to do, but there's so much to general dentistry, and some of the best thing you can do is just get out there and get practicing, and you can get what I think Penny's getting is basically a GPR, more experience with me than she would be in a GPR. And she's, in a GPR, you're just really maybe dealing with a lot more medically complex patients in a hospital setting. So you may not be getting the true experience that you could be getting if you just started getting going in private practice. And I'll talk about it a little bit more, but as far as specialty goes, you can really specialize a little bit on your own once you're out as well. And is there anything you want to add to that? Oh, the mentorship too.
Yes, which is gold mine, right? But unless you really want to be an oral surgeon, like you're applying to dental school right now thinking, I'm going to be an oral surgeon one day.
Yeah,
so that GPR is really going to help you because you're going to be working in a hospital setting, dealing with complex situations every day. But if being a general dentist and trying to do all the things that you can do being in the general dentist school, I don't think you need to go out there and get another year of experience because that experience is not going to count in the private because it's totally different as well. I don't think you're going to see a lot of patients with cancer, a lot of patients with really complex situations come to a dental clinic. They usually will go to the hospital unless you want to work. So that's why we kind of feel like if this is what you want to do in the future, then I don't think GPR
is something you need to worry about.
Don't worry about, because that's another stress. I know when I was in first year dental school, everybody would talk, oh, do you want to specialize? Do you want to do this? I was like, I don't know, because this is my first year.
But it's a stress, yeah.
It's unnecessary.
We're trying to alleviate stress. Okay. This is my little spiel about, we're talking about specializing here. Yeah, I'm not a specialist, okay? There's several specialties of dentistry, and we all know what they are. You know, endodontics, prosthodontics, oral surgery, periodontics, those things. When I say, you know, specialize without being in a specialty program, again, we're trying to help you feel like this is attainable. You don't have to jump right into a specialty program. You can certainly go back to school, of course. But there's nothing like being the general dentist. And being the general dentist is kind of like being the quarterback. And so, yeah, I don't know a lot about football. Don't laugh at me, but someone put my head on this on this football player, and then I put the tube in there just to kind of give you a laugh. But the point is that we sometimes think that that the JP is not really a big player, not a cool player. Sorry, but we are the quarterback. We're pretty much the coolest player, I think, in dentistry. And so I want to say that first of all. And really, in my 21 years of practice, I am very specialized. I do very specialized things. I say no to a lot of things in general dentistry, and it doesn't even come into the clinic because even Penny, we don't do it. We don't think it's part of what our clinic's all about. So, you know, you just don't have to get caught up in that. And you want to realize that when you become that GP dentist, you are the quarterback. And as far as I know, again, I'm not really big on football, but I know it's pretty important player. So you get to really coordinate everything. You are in charge. Those patients are going to look to you to really give them what they feel the honest answer. Sometimes they feel by a specialist, they feel they're being upsold, and it's just not a good feeling because they don't have a long enough relationship. You build these relationships with patients, and you really carry the ball or the tooth all the way to the end zone.
Yeah, your patients are going to become your family. So that's,
that's so it's very special thing.
You deal with every GP.
Yeah. So anyway, that's just my spiel on that. So I'm going to show you now, though, just a little video of something that we do in our clinic, which is digital smile design. And it's a process in which, again, we're co-branded with DSD. I'm a DSD master, which means when I'm designing smiles, I'm doing everything digitally on the computer, and then I'm letting the patients try in their mouth that smile. So I'm going to show you a little video.
And this is before they've done
committed to
anything
treatment
on their teeth. So basically, it's a smile makeover, but digital to get them the feel of what they can look like.
Right, but we actually put the designed smile in 3D. We print it, and then we put it in their mouth so they can experience what their smile could look like. And often people tear up, they swear, they kind of like, they can't stop staring, their mouth's open, it's the floor. So there's a lot of like really cool things you can do. Like I said, as a GP, I'm a GP dentist, of course, cosmetic dentistry being something that I've really done a lot of, but it's just really cool, and I wanted to show you kind of what a dramatic difference that teeth and smiles make. Some people think cosmetic dentistry, and this is just a little breakdown of a barrier here, but some people think that cosmetic dentistry is not real dentistry, not good dentistry. It's not safe dentistry. There's a lot of kind of bad. But when you see what happens to a patient when they have a smile that they've always dreamed of, or when they have a smile that they absolutely love, I get to impact so much more than the health of the tooth. I get to impact mental health, physical health. I get to impact how they
self-confidence,
their relationships with other people. I get to impact just how they become as a person. You really see them bloom, basically. So being able to show them this preview of their smile before we even start is often a very emotional thing. And we do also call it emotional dentistry. So it's not just, like I say, just dentistry. It's emotional dentistry, and it's really exciting. And we do a few cases of this a week. Of course, this is a big thing. There's a cost involved. Patients do pay for the planning side. But overall, it's a really fun thing. So I'm going to show you just an example. Consult room, and you can see our patient, and you can see the difference. So he's watching this on the screen, and it just makes him look different. I mean, and he was really self-conscious about these gaps and just how worn down his teeth were. And then when we showed him this, it was like, when can I start? And then of course, once we do the treatment, they come in, and it's something that they really are even happier with generally, but it can be a very long day in the chair. So a case like this, we probably have them booked for 4 or 5 hours to actually do the teeth this way. All right, maybe there'll be questions about that at the end. Okay, so let's see here. So current life at the clinic. We're pretty much detectives.
That's what a GP feels like, because we go to the core of the problem.
And we build the relationship, and then we kind of help figure out where they need to go, but we've got to be detectives first.
Because when a patient walks in, they might just come in saying, oh, I want this, that's why I came in. We really go in and do our own investigation. Like, if you want to get this treatment, you probably need to have your foundation looked at. So that's why we say when we're detectives, like, we really want to go ahead and educate the patient before we really put the treatment out there. So a lot of the dentistry these days is a lot of preventive and education as well. So it's not really just treatment, it's about preventive dentistry and educating the
whole
patients.
Health dentistry.
Whole health, because your mouth is connected to your body, and then people think that you won't get diseases transmitted from your oral hygiene too. Which is, dentistry is linked to your body in so many ways that we need to educate our patients. We need to let them know there's so many things that we do to make sure you have a healthy smile, overall healthy body.
Oh, and on that note, I do want to say we also treat sleep apnea in our clinic. We treat people with snoring and sleep apnea and other sleep-related disorders. And when I do the first clinical exam on the patient, I'm looking for signs in the mouth that will tell me that this patient has sleep apnea. So often I know that they may have sleeping issues long before the patient even really recognizes that, and then we refer them to the sleep clinic. And then they may come back, and we actually can help treat things like sleep apnea. And by doing that, we're helping the patient lower blood pressure, reduce risk of heart attack, reduce risk of stroke, and just have a better life, right? So they may be I've had so many great reviews, and in fact, sleep medicine is really a big part of dentistry in today's world. You probably won't learn about it in dental school per se, but it's really becoming a really great way that dentists can participate and help patients with their whole health. And a lot of the clues are right there in the mouth. Yeah. So we are a collaborative and multidisciplinary clinic. We have a video at the end to show you a typical new patient experience that we made. And, just the different ways. We kind of touched on this before about being a sensory-friendly clinic. We're really focused on things like this. You can see in the lower right corner, it's a scanner, and it actually can help us detect cavities. Without x-rays. So we were part of the study that proved that, and that's now a real thing. We can actually detect decay between the teeth without x-rays using this type of technology. So, we just do it all, and it's very fun. So we hope that comes across. All right, so 3 things we think you need to master to become a successful dentist, right?
The most important is communication, because you're in a field where you're going to be talking to people every day, convincing them, educating them, engaging them, and motivating your patients. So we need good quality communication. So if this would be the right time for you to think about how can I excel better,
to work on your communication skills.
Because being in dental school, you're going to be really stressed just going through courses, getting your credits in. But you don't realize that once you graduate, most of the dentistry, the first part is you seeing the patient. So as dental students, we don't really think about the first aspect, how to talk.
It's the simplest thing, though.
And how would you convince your patient to have that treatment plan if you have that gap in between? So I think that's the first and foremost thing that you
Very important. And actually, the most successful dentists are the best communicators, and that is true.
Yeah.
Yep. So the second one, it's so funny. We put top 3 things, but then we added 4.
Yes.
We couldn't help ourselves. So finding the best parts of your day. Dentistry can be stressful, but it's really important that you are healthy yourself and you keep your mindset and your routines and your habits really in check. Mental health is a huge thing all across in every profession. But in dentistry, it's sometimes just one of those really big, important things that if we can get into a good, even in undergrad or even when you're in dental school, get into those great habits and routines, it's going to serve you really well.
Just how to manage your day better and not stress so much, because this is a lifelong career. Like if you stress,
you will burn out.
You will burn out. If you don't have a way to manage your stress, then your mental health won't let you work physically in the clinic. So really, you just want to make sure you're
strong.
You're strong and you're taking care of yourself before you go and take care of the patients.
This kind of goes into what theme was too tonight. Is number 3 is just deciding what you want to do and just sort of saying no. Not at first, maybe you want to try everything, but really recognize early the procedures that really light you up and really dive into those. Take more CE in those, and just you can practice with just doing that if that's what you want. You could still be called a GP dentist or a cosmetic dentist, whatever you want. I think that's really important. I've certainly done that, and encouraging Penny to do that too. And I think it's going to serve her well earlier in her career than it took me to figure that out. So I really encourage that.
And you're going to find that pretty soon, because you will be doing all the procedures. The school will teach you everything. You need that foundation. So that's really important. But once you go out and you start doing the procedures on a daily basis, you will find that, okay, I don't really find this exciting anymore. But I find this part of dentistry really exciting. So I'm going to focus on that part, and I'm going to make my life easier. I don't want to be a perfectionist in everything that I deal with, but this is my niche. So that really does help a lot of people.
And don't be afraid of that. Like, just do it.
Don't be afraid, because once you find passion, I don't think you're going to have fear.
Yeah, and it won't matter because you'll just have a reason to get it a bit. The last one is just making social media connections and really building your brand. I've seen a lot of dental students doing that, actually. They start right from the beginning, but thinking... I did it as soon as I opened my practice 7+ years ago, and I was one of the few dentists on social media. And I would say in Canada now, I probably am one of the most active clinics on social media. So we're going to give you our Instagram handles at the end. I even teach courses in specific types of dentistry and coach dentists as well. So that's something that I've been doing on the side in my later years as well. So you don't get to make those connections and find those people, though, and have ways to reach out and ask things unless you're connected. You see who's out there, what's going on, and in addition to that, building your brand and just again, you don't have to share everything about your private life, but just if you are passionate about dentistry, it's going to really show, and that's really great to kind of build you up no matter what practice you're in. So Penny has her own Instagram in addition to she's on my Instagram, right? So
this is important, because you are going to be entering the dentistry world, and there are so many of us out there. So if you have social media, you're going to have greater connections, and really a lot of people reach out to each other, and if they have questions regarding treatment, it's the best way to stay connected, not only to other dentists but also to your patients. So I think it's amazing.
Yeah. So what do we got next, Penny?
So we got a little video.
So we made a little video. This is the outside of our clinic. It was an old Harvey's restaurant that I renovated into a dental clinic, and so we just made this little video just so you can see kind of what happens and some of the technology that we use in our clinic. It's short, and it's probably going to end up on our social media after, but no one else has seen this until now. But yeah, and then we will actually, I'm going to go ahead. No, we'll show the socials after, but we'll play this video first. paycheck from Happy's. And this is where we show you what the future smile could look like. This is how we do Invisalign. We kind of guide the teeth individually. We choose which teeth are going to move where and when, and we just show the patient how we're in control of those teeth. This is our internal camera. It shows the pictures. We do. So yeah, so hope that was helpful. You can see a little glimpse into what the practice is all about. We, Penny and I we used to go live on Instagram sometimes. We're going to be going live in a minute here as well, but we just love to share what we do in our clinic. So we put our socials on here. So I'm going to skip to the next slide. How you want to reach us. So just take a screenshot of this so you don't miss anything. Of course, it's at Dr. Dhaliwal DDS, and mine is at Dr. Peggy Bown. My newest Instagram account called The Modern Dentist. It's one that I'm building right now. It's much fewer followers, so I encourage you to follow that as well. There's lots of going to be just dental related things on there. And that's also in keeping with the courses that I offer called the Modern Dentist courses. I've done many YouTube videos. So we have my YouTube channel is called Peggy Bown Dentistry. So that's like kind of geared towards the public, educating the public. There's some other dental things on there, but there's a wisdom tooth extraction video on there that really got a lot of attention. might like to do surgery after that. Yeah, and I have a regular podcast called The Truth About Dentistry, and that's on, of course, Spotify and Apple Podcasts. So check that out. Again, that might just sort of either help you decide you like dentistry, or maybe you'll learn something that really helps you make other decisions. But either way, you can find us all these ways, and of course with our emails, Peggy and Penny at smilesbybown.com. So I think that's it. I'm going to kind of hand it over here, Carol.
Yes, thank you so much for the presentation. It was very informative. And thank you for everyone that's watching. Now we're going to move to the Q&A section. So we're going to go on live on Instagram. And our handle is at Fresh Dental Shadowing. So everyone, please join the Instagram live. Thank you.